Good afternoon, Peter Goertz. I'm a psychiatrist. Hypnosis and sodium amytal interviews. A few words about these approaches. I have a little experience, not a lot, and I'll tell you what my experience is. There's a lot of emphasis nowadays in modern medicine on technology and medications, but it's also important, it seems, to realize the power of the mind. And of course, the power of the mind tends not to have side effects. So in other words, our beliefs, even the subconscious, unconscious beliefs, are very important and they can have physical consequences. Herbert Spiegel was a very famous psychiatrist and he knew a lot about hypnosis. He was at Columbia University, and his son, David Spiegel, at Stanford, also does a lot of work, or has done a lot of work regarding hypnosis. And I remember going to a course of David Spiegel's at the American Psychiatric Association meeting, maybe 25 years ago almost. And he was talking about a patient of his, a pregnant patient, who had been able, via hypnosis, to change the position of her fetus in her womb. Fascinating. So again, that goes to underscore the power of our beliefs. Surgical procedures have been performed with just hypnosis without anesthesia. So again, at least minor surgery has been done without anesthesia, just with hypnosis. So that's fascinating in itself. Two other big names in psychiatry that are connected with hypnosis are Sigmund Freud and Milton Erickson. Now, as far as myself, one of the psychiatrists I worked with, a senior psychiatrist actually, had taken a course on hypnosis, which many people had taken, given by Herbert Spiegel at Columbia University in New York City. And he'd been quite impressed by that course, and he had been doing hypnosis on and off since then, that older psychiatrist, about maybe 25 years almost older than myself. And as a second-year resident, he also did sodium amytal interviews, that older psychiatrist. And as a second-year resident, I witnessed him do a sodium amytal interview. And it was very interesting. It did seem that the patient was in an altered state. And I don't remember the details, though. And later on, as an attending psychiatrist, I did a few sodium amytal interviews. I was working with an older psychiatrist, another older psychiatrist on a hospital ward, and he guided me with the dosing, etc. I did maybe 2 or 3 sodium amytal interviews, and the first one was very interesting. It was a lady who potentially had been in a fugue state and was found in a hotel room, maybe not even knowing her name at the time, I'm not sure. But anyway, it did seem again that she went into an altered state during the sodium amytal interview and was able to give a good amount of information that she had not previously given. So that was helpful as far as I recall, that sodium amytal interview at the time. Of course, sodium amytal injections, you give them, at least we did, IV, so that can be quite dangerous and people can stop breathing. So these things, I don't think generally sodium amytal interviews are done anymore. And a benzodiazepine might be a possibility to use instead. There may be studies about this, I'm not sure. But again, especially with the barbiturate sodium amytal, there is a significant danger if you inject it IV that the patient might stop breathing. What I did at the time, and I think even a medical student might have helped me in 1 or 2 of those sodium amytal interviews, you just took a butterfly, so not a very big gauge needle, and just very gradually, you talked to the patient before the procedure, told them what was going to happen, got their consent, and then very gradually, little by little, you gave more and more of the sodium amytal until they were in what seemed to be a good state to interview them in. And you don't want to give too much, put them asleep, and you don't want to give too little where they're not really in the desired state. As far as hypnosis, When I was a third-year resident in our outpatient clinic, I had a patient with what we used to call multiple personality disorder, so nowadays dissociative identity disorder. And he, over the years, had been treated by other residents, and at times he found it quite helpful to be hypnotized, and he was very easy to hypnotize. So what might have been called a good hypnotic subject. So periodically, while I was treating him, I think for 2 years, periodically he would ask for hypnosis, and that would help him to relax and be able to cope better. And he did relatively well, again, with the periodic hypnosis. So that's my small amount of experience with these techniques, hypnosis and sodium amytal interviews, and a little bit of my perspective. Thank you.